You ready?
Yeah, 1 second.
Hey, welcome back everybody. This is Troy and Dr. Cory here with Body Talk. Hey, last week we started talking about and started this little series called Bodies in Motion. We had Jeff Cheatham from Accelerated Fitness here. And if you're still looking for them, you can go to Accelerated Fitness Medina or at Accelerated Fitness Medina on Instagram, and you can find them. If you're looking for us, you can find us up on iTunes by searching Body Talk /Troy, and you can find the podcast there. If you're enjoying it, hey, you can do us a huge favor by rating and review the podcast. If you're looking for us here locally, you can go to ohiopain.com and you can contact us directly, 330-242-7669. As always, they can chime in live here on Facebook as well. So you can find us on Facebook. You can watch these every Thursday, 2 p.m. Eastern Standard Time. And if you want to fire some questions off to us, that would be fantastic. We'd be happy to answer those. Even post-show, you can comment here, and Emily or myself, as we see those pop up, we can always reply as well. So, hey, we're going to have some fun today talking about stuff that's near and dear, huh? Yeah.
The bread and butter, meat and potatoes.
Bread and butter, meat and potatoes. So if you're out there and you're listening and you have joint problems, doesn't matter what it is, whether it's an ankle issue, knee issue, neck pain, low back pain. Today we're going to be talking about bodies in motion, but why physical therapy and chiropractics are so important, the fundamentals of these things when it comes to rehabilitation, and how many patients do you think maybe are out there who don't think that they can rehab? How often do we run into this, daily or even weekly here, huh?
Quite often, and it's, to start like with pain is really understanding in your beliefs on the pain that you have or whatever is going on. People will, feel like my pain is so bad, there's nothing I can do. They're scared to move because they're scared they're going to get hurt, or they just feel like, all right, now I'm up a creek without a paddle. I don't know what to do, and they don't know where to go to get help. So it's really understanding and your beliefs on the pain. So, just to briefly run over it, we can have one of a couple things: helpful thoughts, negative thoughts, and then what we call catastrophic thoughts. So helpful thoughts on pain is, okay, pain is there. It's a natural process of the body. I can still move through pain. Pain might be needed to get to my end goal of getting better. Now, we don't want to move through a pain that, is increasingly expansively, 10 out of 10 pain, worst pain ever. If it's continuing to get worse, I just want to tone it back and figure out what is going on that causes that pain. Don't just, treat it on your own and do whatever you want to do and make things worse. But, these thoughts on pain definitely drive where our therapy goes, whether it be chiropractic or physical therapy.
Yeah.
So you can have negative thoughts, which aren't horrible. They're definitely, you can get back to those positive thoughts quicker. There are more thoughts that are like, okay, if I move and I hurt, I'm causing more damage. I don't want to do that. That's when they become, really pulled back, reserved, and don't want to, they want to get better, but they're scared to do some exercise or some things. They'll do movements here and there, but as soon as that pain hits, they stop immediately. Mm-hmm. The worst one, which I see commonly often here, is when people, their view of pain is so bad that we call it catastrophic thoughts. And that's like they're anticipating the pain before it's even there. Mm-hmm. They're so scared to move in any range of motion or move at all. They'll just lay there or sit there, not do anything because they're scared that pain's going to come about. That's going to debilitate them. They feel like they become helpless, and they don't go out and seek help because they're like, I don't care what people say to do. I'm going to hurt, and this pain's bad, and then I'm just going to get even worse. So there's like, it's a slippery slope to get on because that just, leads to depression, things like that, and we want to avoid that as much as possible. And I think the start, the core thing, and we do it here, we ask patients how are they feeling, each day they come in, whether it's chiropractically or physical therapy wise, is rated on a pain scale. At 0 to 10 scale, like 0, no pain, 10, worst pain imaginable. And I feel like it's understanding and really using that. And I don't think people have a full grasp on that. A patient will come in and they're all happy-dory talking, they'll say, my pain's 10 out of 10. Well, if you're 10 out of 10 pain, you should be, in a bed, thriving in pain, like a gunshot.
Fish out of water,
most
around.
Extreme pain ever, you're going to the emergency room versus 0, no pain at all, and then there's everything that falls in between. So really understanding how you feel and your thoughts on those things can really impact how you move, your recovery, and where you reach out to stuff like that. And I think it on both ends, it's with patients, trust in their provider. So their provider giving them, whether it be myself, one of the chiropractors, Dr. Matt, Dr. Billy, Pierre, one of the PTAs, giving them very deliberate directions on how to rehab, how to move, how to move while in pain. So there's a trust there too that needs to be formed with your provider to get better as well. So
I think it's a good point. And I fortunately have personal experience with this. When I went through a microfracture surgery with my right knee in 2016, I would say that, my expectation was that this joint would have improved in about 2 weeks. And I had some pretty unrealistic expectations with that. And it's one that can really begin to drag you down. So from the patient side, I see it because I was one of them, where you work really hard, you get some motion back with it, and then it goes backwards. And then you work really hard the next day, you do it again, and then it goes backwards, and it feels like you can get stuck. But I can tell you from personal experience, if you're out there listening to it, what Dr. Cory said is absolutely right. Is you have to have the mindset that it's going to get better, and it will. And that's where I think a lot of people have tried therapy before, and perhaps it was the wrong type of therapy for the issue. And if I had been in a strengthening type of therapy trying to recover from this knee surgery, I can tell you I'd probably still have problems today. And I think that's an important point too.
To go on what you're saying is, I will go on record and I will tell, no matter what you're doing, recovery-wise, your recovery will never ever be linear. It will never go from point A to point B. You will always get better, feel great. There are going to be peaks and valleys.
Sure.
You're going to have good days and bad days. So having that expectation that from starting day one, patients have surgeries or get injury, I'm just going to work through it, feel great every single day, get better, better, better. Never have a setback in my life, and get to the end, be great. That is an unachievable expectation because you're going to have ups and downs. And understanding that and realizing that makes a world of a difference. So okay, if I have a small setback, it's okay. It just means I overdid it or we have to change something up. So being able to have that mindset early on and progress through it makes it more feasible to get better in a timely manner because you don't have those mental setbacks. So it's never linear. And I'm disappointed when patients come in and say somebody told me I'm just gonna get better right away and never gonna have a setback. It's like, well, unfortunately, it's not the way it works. It's not how our body works. And the big thing we always talk about from that zero to the very end of treatment is time. It takes time. It takes effort. So.
And perseverance. There's a lot to working through these things. Just persevering through and not letting the bad days get you down. Because I remember a few with mine for sure, and lost sleep, and living through a few nights of more than a couple of weeks of just debilitating pain. So. Let's talk a little bit about PT itself.
Okay.
And even chiropractics, because...
Well, we're going to start PT chiro.
Kind of both. I kind of want to touch on, because I'm not sure too many patients kind of grasp this concept, and then we'll drill into some of the notes you've got there, because this is one where I see a lot of pitfalls for patients maybe seeking care elsewhere, is that a pain relief phase versus a strengthening phase. And too often when we approach rehab, or when a rehab's been approached in other places, like we have this young lady who came in yesterday, as you know. And she's been in 8 weeks of pain and basically debilitated, can't move, been laying down for 8 weeks and is now admitted in a nursing home at 55.
Which is absolutely crazy.
And she has severe sciatica, but what are we trying to do for it currently over there? We're strengthening. So we're strengthening something that is unbelievably painful, unbelievably sore, with pressure on a nerve. Probably not a great way to start.
No.
And if you're listening out there and maybe you have pain and you've tried some PT before, chiropractics, and it's in pain, we're not going to fix it right away with strengthening. We have to first start with some core fundamentals of rehabilitation or motion. And just hence the bodies in motion thing.
Exactly.
We just have to start restoring motion. I'll let you drive on there, because I think a lot of things you have here in your notes are going to really drill into motion. The joint just needs to move first. We're not going to fix it first.
No, not at all. I mean, I'm a Ford guy, so say I go to the dealership. We always talk about analogies, simple things to understand. We've used Tim and the Wizard of Oz. If I buy a brand new Mustang, drive it off the lot, smash a pothole, knock my front tires out of alignment, I'm gonna have a tire that probably blows out at the end of time. Some stuff's gonna wear and tear on it. So we think about strengthening right away. If I tighten those bolts down, all right, great, it's tighter, but is it straight? By putting a new tire on, is it going to be good forever? Probably not.
No.
So what we want to do is realign things, whether that be the joints, the muscles, work on neuroplasticity for the nervous system. Our body is more than just one part. It all works together. So straightening those wheels out, cranking those tires, back on, and tightening those bolts in that corrective phase, strengthening after we fix the actual problem. So the motion, those straightening things out, that's the motion we're looking for and going on there. So in the realm of chiropractic care and physical therapy, which I think work hand in hand with doing that, as a chiropractor, we assess the joints I always use the word proper biomechanics, so the way the body moves, making sure joints are positioned the way they should be, so they don't pull on muscles, cause entrapment on nerves. When muscles pinch down, our joints are shifted and our body moves different, nerves can be entrapped. So making sure that we're getting that body aligned, so through adjustments, through some soft tissue work, stuff like that, making sure they're aligned, and then going into strengthening. So, when we start off things, what we do here is McKenzie, therapy. It's a little bit different version of physical therapy that some places do, and most people, when you mention McKenzie, they have no idea what you're talking about. But the first stages are finding those motions that are good, moving in those motions, getting the body back centrated to where it's supposed to be, and then moving to strengthening, because it makes zero sense to strengthen while you're in pain, because you're reinforcing those pain and reinforcing those bad habits. So
you just can't strengthen a motion. You can't strengthen a joint that just doesn't have, like you had mentioned, proper joint mechanics. And what that means is, it's a big word, all it means is the joint's moving properly, the way it's designed to work. So if it doesn't have proper joint mechanics, then the soft tissues around it are guarded, tight, tense, inflamed, and we don't have good mobility. So we don't have good mobility or mechanics. There's no way we're going to strengthen the joint.
Not at all.
And if it's in a bad position, I often relate this one to lower backs. Oftentimes patients come in with a tip pelvis, lower back pain, pain radiating down the leg, things like that. And if we start strengthening the pelvis in a bad position, probably not a good idea.
No, it's going to take even longer to get out of that bad position.
Right. So I love the loosen and move analogy, and when it comes to rehab, it really gets very simple. It doesn't have to be complicated, but we need to loosen things. We need to move things.
Exactly.
Now, we do it in a very comprehensive nature here, but that's kind of the first step.
Comprehensive is important, because to get from point A to point B, you got to know where you're starting. So doing a good exam and analysis and classifying what actually is going on. So, as a chiropractor, we look at ranges of motion, how the body responds to certain pressures on the spine, looking at the musculature, seeing where those muscles are tight and where they are pulling, and seeing where, I'm not just going to go and adjust every part of your body right away, because I don't know what's going on, and I'm not going to adjust something that doesn't need adjusting, because you can over adjust, and then you put at risk stability. So you don't want to go make things unstable, because then you put yourself at risk for injury. So making sure we're knowing where we're addressing, and same on the physical therapy end. I know Pierre does his initial consultation and analysis of the patient. It's 20, 30, 40 minutes sometimes, because he's doing his due diligence to check his boxes and looking at different things. I know in the McKenzie world, there's really three big things that they classify on. So your postural syndromes, your derangements, and your dysfunctions. So posture-wise, if a patient comes in, they're sitting at a desk all day in a slunched over forward posture all day, and that causes the pain. Getting out of that posture relieves the pain. We can then see, okay, it's not too severe. We just need to fix some postural issues. You're a little quicker to respond in those natures, because it's just retraining the body. I'm not really fixing any anatomical abnormalities or any hypertension or hypertonicity in muscles, things like that. The most common one they see is more of a derangement, which is, I think we see a mix of derangement in the next one I'm going to talk about, but derangements are in the sense of a patient moves in different directions. We talk about red lights and green lights when we explain things. So a green light is a motion that feels good. Red light's a bad motion. So patients that are in this category, tend to respond. It takes a little longer, but it's repetitive motions. So the motion we talked about at the beginning, to get out of pain and alleviate those symptoms. So moving in those green lights versus red lights. And I think because we do treat a wider range of population here, and we do treat a lot of chronic issues, I think we see a lot of dysfunctional syndrome patients. And that's whereas patients become injured or something happens and they stop moving completely. So they stop moving, they become ridden with scar tissue, muscles become tight, there's shortening of there's a shortening of those muscles themselves, and it's really common with no movement after injuries. These ones are tough to treat, because there's a expectation, like we said, they're going to get better, no pain, things like that. Well, when we're remodeling tissues, working on those tissues, a lot of these exercises we do are geared towards lengthening those shortened muscles, getting rid of the scar tissue adhesions. It can be painful to do that. So that pain, again, scares patients away. When patients fall in this category, it takes a lot of time, a lot of diligence, and a lot of education. I know we're big on education here, but educating patients that you may feel some soreness or things may hurt when you're doing this, going through this process and doing these exercises, but that's okay. That means we're putting stress on those muscles that need to be stretched out and forming those new movement patterns to get through that process. So again, like classifying these things, knowing what we have to do, educating the patient correctly,
Sure.
and then moving on from there and working as a nice little tandem. That's why I say chiropractic and PT is like the meat and potatoes, because it's where a lot of the battles are won and lost. So.
Yeah, it's really getting down to the frame and structure of someone's issue. This also doesn't really even just apply to acute injury, it applies to avoiding injury.
Yeah.
And when it comes to bodies in motion, we've got a lot of them around here in Medina, because we've got, as we had Jeff Cheatham on
Yep.
last week
Great talk
at
with him.
Accelerated Fitness.
For sure.
You've got CrossFitters, you've got runners, things like this. So if you're an athlete, one of the core fundamentals that I love of CrossFit, they always talk about joint mechanics. So if we don't have proper mobility or flexibility in CrossFit, we always say don't do a movement and repetition, because you're going to create a injury.
Yeah.
So if you're out there and you're listening and you go, hey, okay, this physical therapy, chiropractics, but it also applies to not only that you're trying to get out of an injury, but avoid an injury if you are an athlete, or if you're an everyday guy or gal out there who's maybe doing work in repetition. So any work in repetition, and again, if we're doing things in repetition, hammering, how often do you see a tennis elbow from roofers? Yeah, get a tight muscle, again, not the proper flexibility or mobility. We've lost the flexibility of some of the elbow and muscles that support it. It's going to create an injury. Start hammering in repetition, guess what? Problem.
Yep.
And even something as simple as an air squat.
Yeah.
CrossFitters out there all the time get hurt doing air squats. Why is that? Well, they don't have the proper flexibility and mobility of a hip to open up, get their chest up, go down with their chest up, they start leaning forward, and now we've got a back injury. So I think it's so important to not only apply it to injuries and pain, but avoiding them. And that's good old maintenance.
Yeah.
Maybe touch on somebody else you got over here. You got all kinds of fun stuff written down here. So what else?
The maintenance, or just understanding how the body works. So we talk about some things in school, and people that know exercise physiology, or just that are just exercise junkies that like to know about the body. There's something called an alpha gamma loop.
Yeah, okay, yeah, that's good.
It sounds pretty simple, right? Some people have no idea. So the short condensed form of it, it regulates the muscle tension of the muscles in our body. So we have antagonistic and protagonistic muscles that work, in tandem against and for each other, things like that. Making sure their balance is extremely key, and making sure that the muscles themselves are balanced. So we have, the muscle, the skeletal muscle. So you take your biceps, for example, it's a skeletal muscle. And you break it down into muscle fibers, and you have a bunch of nerves and sensors and receptors all over the place that regulate its tension, regulate making sure it stays loose and active. And balance is very key within that system. So we have sensory neurons that feed back to the spinal cord. We have alpha motor neurons that really control the muscle itself. Going down even deeper, we have the gamma motor neurons that but really control the muscle fibers. So on a smaller level. So it's the big muscle, you have muscle fibers, muscle spindles, going down to small microscopic things like that. And making sure that those are balanced is key, because if we form imbalances, muscles are going to move improperly, or we're going to cause joints to move improperly. We have bad movement patterns, or we form muscle memory. So if we're immobile, and whether we're injured or not injured, our muscles are going to become deconditioned. They're going to form bad movement patterns if we're in bad posture. Those bad squatting, form that you do. We form muscle patterns and muscle memory in everything that we do. So the more we form bad ones, the more our body's going to move improperly. So you're going to have imbalance, between muscle groups. You're going to have pain with that muscle tension. You're going to cause joints to move improperly, which can cause issues with the knees, the hips, the elbows, any joints you have. They're susceptible to injury. You're going to have the muscles themselves pulling the skeletal system out of place, out of alignment. So the chiropractor, that's what we look at. So all those things, cause an increased risk of injury. So making sure we're moving and being aware of our muscles and how they move. So having a conscious, understanding, going through. You don't have to have, exercise with weights. Just going through motions and slow and controlled really activates those muscles. And people think they can just, stretch, go to a chiropractor, get a massage, all individually to really help this. And in all honesty, each of those modalities alone, even physical therapy alone, they work a little bit, but they're not substantial enough to cause those long-term effects. So it really gets you feeling better. All of them together will have us, activating muscle groups, alleviating muscle tension, aligning the body properly. So attacking all this at once and doing it together is really important in treating the body as a whole. and making sure that we're, becoming more mobile, but also strengthening in the end, and
Sure.
making sure things work hand in hand. So I would encourage people to go to a facility, love ours, so you come to ours. Everybody else is, man. But, go to a place that really does all of that together, not just, pick and choose, an a la carte type thing. So.
Yeah. I like that you mentioned the antagonistic, protagonistic thing. I think it's a really important point, and in the muscle memory, because a lot of patients or a lot of folks that come in will have the perception that maybe with PT or chiropractics everything's going to be fixed in first visit to 3 visits, and we have this problem that's been smoldering along for years. And one of the big things, if you're listening to this out there, is that it really takes a lot of time and patience, because trying to decrease those compensatory patterns, or these patterns that your body's gotten into that are these muscle memory patterns, take time to first retrain out of it, number one, so getting out of that pattern and then trained into a new pattern. And that typically for most joints, just so if you're listening, is at least a minimum 6 to 8 week process. So a lot of folks think once I'm out of pain, that's it. But how often do you see, like, if we just go through this relief phase of physical therapy, so we get through maybe 2 to 4 weeks of PT, chiropractics, maybe some massage therapy, whatever it may be doing that you're up to, and things feel better, and then you stop, and then 6 months later, 3 months later, a year later, your pain comes back.
It's so common that happens. It's unfortunate because when, like you said, that relief phase, we get to baseline again.
Yeah.
You're right before that injury, so you did that squat, or you picked up that Tupperware container. The moment before that injury occurred, that's where you're at.
Right.
So I'm gonna go pick up a Tupperware container again, or do a squat, or do something
Right
like
back
that.
at it.
You're right back to square zero again, injured and hurt. So getting to baseline is key. Susceptibility is there. That's why we have our, the DMEs, back braces, things that have to protect us right at this point. Then we start strengthening to prevent these injuries from reoccurring.
Sure.
And that prevention and that corrective strengthening phase is, people just, it disheartens me when people leave before that. It's like, crap, I'm going to see you again. It's like you said, 3 months, 6 months, a week, a year. It doesn't matter the time it takes to get here. Inevitably, they're going to be back in the same situation. And that's what we don't want to have happen. And that builds a dependency too. I don't want anybody to become dependent on me. I love adjusting you. I love seeing you every day. But I want you to come back because you like coming, you feel great, you want to continue to feel great.
Sure.
Not because you're in pain. When people come in pain, that makes me tough. Like the patient yesterday, she was like in 10 out of 10 excruciating pain.
That's 10 out of 10 pain.
Sometimes we do treatment, that pain is increased a little bit, or we don't relieve it right away. It makes you feel bad because, like, hey, I'm here to help you, but we know at the same time, working through that pain, it's a part of the process, and we know that the end goal when you're out of pain, that makes my job, it's worth it. So.
I think that's a good point too. I'm going to talk about 3 points to build on that. Treatment failures. Treatment failures typically aren't because the therapy wasn't effective. It's because we didn't communicate something to you properly, typically. And it's one of these 3 things typically that occurs, that if we had communicated this well to you, or maybe you didn't listen, maybe we did, and maybe you didn't listen, but number one reason oftentimes for treatment failure is, just like this young lady yesterday that's in severe pain, we work with it, it might be a little more sore as we start.
Yeah.
Because we're going to move some things that are really resistant to movement early on. That's extremely common.
Yeah.
So if you've tried PT out there, and maybe now you're trying pain management or injections, maybe you've been through surgery, and you're like, nuts, I'm still stuck. There is a lot of value to this. Isn't going to be easy to work through in the start, so we have to work through it a little bit. Now, it's not a no pain, no gain kind of mentality. That's not for sure. That old school no pain, no gain thing, that's out the door.
Yeah.
But that's the number one reason for failure. Oh, I tried a visit or 2 and it made it worse. That's extremely common. And if we fail to mention that to you, shame on us.
Yeah, that's a pitfall on our end, and that's unfortunate. And we should make sure. That's why communication is very important.
Sure.
So if any patient would ever have a question, or anybody has a question, ask. If you're seeing us, ask us. If you're seeing another provider, ask the provider. Get a clear understanding of what they mean. If you have any questions, talk. I mean, it's a two-way street there, and making sure we communicate.
Guys, when you come out of surgery, for instance, like rotator cuff surgery, you have this surgery, go to your first PT visit. Guess what? That is not going to be a fun day. That's for sure. First post-op total knee visit is not going to be a fun day, nor is the second, third, fourth, fifth, or sixth. So it's going to hurt, and it's just like any other injury.
Yeah.
Even if it's not post-surgical, there's some discomfort as we begin to work with things. Number 2 reason, and again, if we don't communicate this, this really frustrates people. I get temporary relief. How often do you hear that?
A lot.
So I get temporary relief, but then it comes back. We expect that.
Yeah.
Your providers out there, if you're in other PT offices or chiropractic or in any other kind of rehabilitative center, we expect it. Your body has this muscle memory.
Yeah.
So as we're trying to create bodies in motion, we're going to move things, but guess what? That muscle memory, usually within 12 to 24 hours, coming right back.
The body is extremely resilient to change. It takes repetitive use and exercise to do it. So when we say, well, I'm not coming in 3 times a week, 2 times a week, well, it's because, like you said, 24, 48 hours later, an adjustment or the exercises you did, it's not going to stick right away.
Sure.
It's like learning something, a child learning something for the first time.
Yeah.
You're not going to do it once, or you go try a new sport.
Yeah.
You're not going to get it the first time.
Yeah.
It takes time, repetition. Practice makes perfect. So
Yeah.
really getting at it and getting at it diligently and with a purpose makes all the difference in the world.
I oftentimes talk to patients. I'm upfront kind of working with new patients, and I'm always listening for this for some of their prior treatments. And it's one of my questions. If they've seen a chiropractor or physical therapist previously, did you get temporary relief? Because if they get temporary relief, that typically means we can get it. That means something moved, it's just getting there, and that brings us into treatment failure number 3, which is we weren't frequent or intense enough with it. And oftentimes, follow-up questions that I often present to patients when it's trying to get these joints moving right is if they got temporary relief, then I always ask what was the frequency? How often were we going? Once or twice a week? Not going to do it either.
Yeah.
And was there homework? No homework? We're still not going to get it. So the frequency, intensity of your treatment when it comes to these things early on is also important. Those are our top 3 failures. And oftentimes we don't communicate those things effectively to patients, and especially in the pain relief phase, because you're trying to get out of pain and you go, oh, it's only temporary. Oh, first one made it worse. Oh, it's frustrating. So these go fast.
They do. Have fun talking too.
So I think we need to build on this one next week. We'll carry on with this bodies in motion piece here. Hey, a couple things. We need some help down at Haven of Rest, okay? If you're an active patient out there, my wife and my family and I, we volunteer out at the Haven of Rest in Akron. We need toothbrushes, okay? So we need toothbrushes. So as we go down and volunteer and help the homeless down there, so talk about little housekeeping things. We need some toothbrushes if you're in the area. If you're coming in, stopping in for a visit, or you're just a Medina resident, you don't know, it doesn't matter, drop off a toothbrush. We could really use it to get it over to the facility over at Haven of Rest to help these folks. This is a cold time of year. They get busy over there, and they need volunteers as well. So we need help over there if anybody wants to get involved. If you enjoyed the podcast, we're going to continue on with this next week. We have big news coming around the Super Bowl, hey? So some big stuff that we're going to be talking about here that we did this week. We've got a lot of things going on next week. So big things coming. You can find us again on iTunes. You can go to BodyTalk/Troy, find us there. You can find us on Instagram, advanced_spine. Check us out on Facebook, on the web at ohiopain.com. Dr. Cory, final thoughts.
Final thoughts. Anytime you're going anywhere to get any kind of relief, whether it be here, any kind of providers, go somewhere that they care. And I say, what I mean by that is they listen to you, listen to your problem, let you talk, tell your story, where you're coming, where you're at now, and where you're going in the future, pain-wise and goals-wise. Because they don't listen. I'm not saying they don't care, but they don't really understand completely your issue. And the ones that care, their goal at the end, what makes them feel good is you getting better. So find somewhere that cares about you and where you're going. So it's important.
Make sure they're treating you, not the problem.
Exactly.
I think that's a key point.
Yeah, for sure.
All right. Until next time, man.
Adios.